Men are not broken for wanting sex. They are biological for needing it, and science proves this in ways most people have never been told. From the moment a boy enters puberty, his body is programmed to use sexual signaling as a core regulator of survival, strength, and mental stability. This is not about pleasure or morality. This is about chemistry, hormones, and the silent systems that keep a man alive and functional. When those systems are ignored or suppressed, the consequences don't arrive overnight. They creep in slowly, disguised as fatigue, loss of confidence, irritability, weight gain, and emotional numbness, until one day a man no longer recognizes himself. Testosterone is often talked about as the male hormone, but very few men are told what truly controls it. Sexual activity is one of the strongest natural regulators of testosterone rhythm in the male body. Research published in endocrinology journals shows that sexual arousal and release stimulate the hypothalamic pituitary gonadal axis, the master control system that tells the testes when and how much testosterone to produce. When sexual signals are regularly activated, testosterone follows a healthy daily rise and fall. When those signals are absent for long periods, the brain slowly reduces its demand, and testosterone production quietly declines. This decline doesn't always show up as a dramatic crash on blood tests. Instead, it shows up in the way a man feels. He wakes up tired even after sleeping. His motivation fades. His drive for life weakens. His muscles soften. His belly grows. His patience shortens. Studies have shown that men with chronically low sexual activity often experience symptoms of low testosterone even when their lab numbers fall within so-called normal ranges. The body responds to signals, not labels, and silence from sexual pathways tells the brain that strength is no longer required. Sex also directly affects the male brain. During healthy sexual activity, dopamine floods reward circuits responsible for motivation, focus, and goal-directed behavior. This is the same chemical that pushes men to build, compete, and protect. Without regular activation, dopamine sensitivity drops. Life feels flat. Tasks feel heavy. Men begin chasing artificial stimulation through junk food, endless scrolling, or substances, not realizing the real deficiency is biological connection. At the same time, oxytocin is released, a hormone often misunderstood as emotional or soft, but in men it plays a crucial role in stress regulation and nervous system balance. Oxytocin counteracts cortisol, the stress hormone that destroys testosterone, damages blood vessels, and accelerates aging. Chronic sexual deprivation has been associated with higher baseline cortisol levels, meaning the body remains in a low-grade fight-or-flight state. Over time, this state shrinks the hippocampus, the brain's memory and emotional regulation center, increasing the risk of anxiety, depression, and cognitive decline. This is why men who lack intimacy often report mental restlessness, poor sleep, and unexplained anger. It is not weakness, it is biology screaming for balance. One of the most shocking facts rarely discussed is how sexual inactivity affects male identity at a neurological level. Brain imaging studies have shown that regular sexual activity helps maintain activity in regions linked to self-esteem, confidence, and assertiveness. When these circuits go underused, the brain begins reallocating resources. Men don't just lose desire, they lose presence. They stop feeling sharp, decisive, and alive. This is often misdiagnosed as midlife crisis or depression when the root cause is unaddressed biological deprivation. There is also a deep connection between sexual activity and sleep, the foundation of all male health. After orgasm, the body releases prolactin and serotonin, chemicals that promote relaxation and deep sleep. Deep sleep is when the majority of testosterone is produced. Men who lack sexual release often experience fragmented sleep, lower REM cycles, and reduced growth hormone output. Over months and years, this sleep disruption compounds hormonal decline, creating a vicious cycle of fatigue, low libido, and emotional instability. The immune system is not spared either. Studies have found that sexually active men show higher levels of immunoglobulin A, a key antibody that protects against infections. Chronic stress and hormonal imbalance weaken immune defenses, making men more susceptible to illness as they age. What looks like just getting older is often a body deprived of its natural regulatory signals. Society has taught men to feel guilt or shame around their sexual needs, framing desire as something to suppress or control at all costs. But suppression is not the same as discipline. Suppression teaches the brain that natural signals are dangerous, forcing stress hormones to rise and adaptive systems to shut down. Over time, this internal conflict creates psychological tension that manifests as irritability, emotional withdrawal, or compulsive behavior. The body always seeks balance, and when healthy expression is blocked, unhealthy outlets emerge. This does not mean excess is healthy. Addiction rewires the brain in damaging ways. But balance is not abstinence. Balance is alignment between biology and behavior. Medical literature consistently shows that men who maintain regular, moderate sexual activity have better hormonal profiles, stronger mental health markers, and higher life satisfaction than men who are chronically inactive or chronically compulsive. Perhaps the most uncomfortable truth is this: men who deny their sexual biology often age faster, not because time moves quicker, but because their repair systems slow down. Testosterone, growth hormone, and dopamine are anti-aging chemicals. They maintain muscle, protect bones, sharpen cognition, and preserve metabolic health. Sexual activity is one of the natural keys that keeps these systems communicating. When that key is removed, the locks slowly rust. This is why the conversation matters, not to promote indulgence, but to restore understanding. Men do not need permission to be biological. They need education. They need truth. They need to know that their desire is not a flaw, but a signal. And like all signals in the body, it exists for a reason. When sexual health is respected, men become calmer, clearer, and more grounded. Their energy stabilizes, their confidence returns, their relationships improve, their bodies respond. When it is ignored or shamed, the cost is paid in silence, through pills, diagnoses, and quiet suffering that could have been prevented. Sex is not separate from health. It is woven into the nervous system, the endocrine system, the immune system, and the mind itself. To deny this is to deny biology. To understand it is to reclaim power. And men who reclaim that power don't just live longer. They live sharper, stronger, and more fully until the very end. A man's heart does not fail suddenly. It weakens quietly, vessel by vessel, year by year, often long before symptoms appear. And one of the most misunderstood protectors of the male heart is not a pill, not a procedure, but a biological rhythm that medicine rarely explains clearly. Sexual activity is not just intimacy. It is a full-body vascular event, a neurological activation, and a hormonal reset that trains the male cardiovascular system to stay alive. During sexual arousal, the body releases nitric oxide, the same molecule cardiologists target with prescription drugs to open blood vessels. Nitric oxide relaxes the smooth muscles lining arteries, allowing blood to flow freely, lowering resistance, and reducing pressure on the heart. This process improves endothelial function, the single most important predictor of heart disease. When the endothelium fails, plaques form, arteries stiffen, and the heart is forced to work harder with every beat. Regular sexual activity repeatedly activates this nitric oxide pathway, reminding blood vessels how to expand, respond, and heal. Large population studies published in cardiology journals have shown that men who engage in sexual activity 2 to 3 times per week have a significantly lower risk of fatal heart events compared to men who are sexually inactive. This protection is not psychological, it is physiological. Sex raises heart rate to a moderate level similar to brisk walking or light jogging. It improves circulation without overwhelming the system. For aging men, this gentle but consistent cardiovascular stimulation becomes critical. A heart that is never challenged grows fragile. A heart that is trained stays resilient. The fear many men carry is that sex is dangerous for the heart. In reality, it is often the opposite. Cardiac events during sex are extremely rare, and when they occur, they almost always involve men with severe underlying disease who are sedentary and inactive in daily life. The real danger is not sexual activity. The real danger is a heart that has not been used, stretched, or signaled properly for years. But the heart is only part of the story. Blood flow is the foundation of male health, and sexual function is the body's most sensitive indicator of vascular integrity. Erectile tissue is lined with tiny blood vessels far smaller than coronary arteries. When blood flow begins to decline, erectile difficulties often appear years before chest pain or stroke. This is why urologists often say the penis is the body's early warning system. When sexual function fades, it is frequently the first sign of systemic vascular disease. Men who remain sexually active tend to preserve vascular responsiveness. Each erection requires healthy arterial dilation, intact nerve signaling, and efficient blood delivery. This repeated demand keeps vessels functional. When sexual activity stops, these pathways go dormant. Blood flow becomes sluggish, vessel walls stiffen, nitric oxide production drops. Over time, the body forgets how to deliver blood efficiently, increasing the risk of hypertension, atherosclerosis, and metabolic disease. Sex also directly affects cholesterol metabolism. Research has shown that men with regular sexual activity often exhibit higher levels of HDL cholesterol, the good cholesterol that removes plaque from arteries. At the same time, stress reduction from intimacy lowers cortisol, a hormone that promotes fat accumulation, inflammation, and arterial damage when chronically elevated. Lower cortisol means less inflammation. Less inflammation means slower plaque formation. This is not coincidence, it is chemistry. The prostate, another organ men fear as they age, is also deeply connected to sexual rhythm. The prostate is not designed for stagnation. It produces fluid continuously, and when that fluid is not released, congestion and inflammation can develop. Multiple long-term studies, including one from Harvard involving tens of thousands of men, found that frequent ejaculation was associated with a significantly reduced risk of prostate cancer. The mechanism is believed to involve the clearance of inflammatory secretions, reduced oxidative stress, and improved cellular turnover. Men who suppress ejaculation for long periods may unknowingly increase prostatic pressure, inflammation, and cellular stress. Over years, this environment may contribute to benign enlargement, urinary symptoms, and potentially malignant changes. This does not mean excess is healthy. It means regularity matters. The prostate thrives on balance, not silence. Aging accelerates when repair systems slow down, and sexual activity plays a surprising role in slowing this process. During healthy sexual engagement, the body releases growth hormone and DHEA, two substances linked to tissue repair, muscle maintenance, bone density, and skin health. These hormones decline naturally with age, but inactivity accelerates their loss. Men who remain sexually active often show better muscle tone, stronger bones, and improved metabolic markers compared to their inactive peers. Sleep quality, one of the strongest predictors of longevity, is also influenced by sexual health. After orgasm, the nervous system shifts into parasympathetic mode, lowering heart rate and blood pressure. Serotonin and prolactin rise, promoting deep, restorative sleep. Deep sleep is when growth hormone peaks and cellular repair occurs. Men who lack sexual release often report restless sleep, frequent waking, and early morning fatigue. Over time, this sleep disruption compounds cardiovascular risk, insulin resistance, and cognitive decline. The immune system responds as well. Studies have demonstrated that sexually active men have higher levels of immunoglobulin A, an antibody critical for defending against respiratory and gastrointestinal infections. Chronic stress and loneliness weaken immune response. Intimacy counters both. A stronger immune system means fewer infections, less inflammation, and lower long-term disease burden. Perhaps the most overlooked effect of sexual health is its impact on mortality itself. Long-term observational studies have found that men who maintain sexual activity into older age tend to live longer, not because sex is magic, but because it reflects integrated health. A body capable of sexual function is a body with working nerves, vessels, hormones, and metabolism. Sexual inactivity is often not the cause of decline, but it accelerates decline once it begins. Modern medicine often separates systems into specialties, but the body does not work that way. The heart, the prostate, the brain, and the endocrine system communicate constantly. Sexual activity is one of the few natural behaviors that activates all of them at once. When that activation disappears, systems fall out of sync. Aging speeds up. Disease finds opportunity. This is not an argument for obsession. It is an argument for respect. Men do not need reckless behavior. They need understanding of how deeply their biology depends on rhythm, circulation, and connection. Sexual health is not indulgence. It is maintenance. When men stay sexually engaged in a healthy, balanced way, their blood flows better, their hearts work smarter, their prostates stay calmer, and their bodies age more slowly. When this truth is ignored, men often end up treating symptoms one by one, never realizing that a fundamental regulator of their health was removed years earlier. Sex does not steal energy from a man. It teaches his body how to use energy properly. It reminds vessels how to open, hormones how to communicate, and organs how to repair. And men who understand this don't just protect their hearts and prostates, they protect their future. Men are often pushed into extremes. On one side, they are told to suppress their sexual drive, to silence it, control it, deny it, as if desire itself is dangerous. On the other side, they are pulled into excess, addiction, endless stimulation, and compulsive behavior that drains the body instead of strengthening it. Science shows that both extremes damage male health. The real power lies in balance, and balance is not a moral idea. It is a biological requirement. The male brain is wired for reward, rhythm, and recovery. Sexual activity activates all three. But when sexual signals disappear completely, the brain does not become calm or disciplined. It becomes stressed. When sexual signals are overstimulated without rest or meaning, the brain does not become satisfied. It becomes numb. In both cases, the nervous system loses its natural calibration. Research in neuroscience shows that dopamine, the motivation and drive chemical, follows a curve. Healthy stimulation increases motivation, confidence, and focus. Chronic deprivation lowers dopamine sensitivity, leading to apathy, low mood, and lack of purpose. Chronic overstimulation floods the brain with dopamine, forcing receptors to downregulate. The result is the same emotional flatness, but now paired with compulsive behavior and shame. Different paths, same damage. Men who suppress sexual expression for long periods often experience rising cortisol levels. Cortisol is not just a stress hormone, it is a testosterone killer. Elevated cortisol blocks the receptors that allow testosterone to function properly, even when blood levels appear normal. Over time, this hormonal conflict leads to fatigue, loss of muscle, increased abdominal fat, poor sleep, and emotional irritability. Many men in this state believe they are simply aging, unaware that their biology is responding to chronic internal stress. On the other extreme, addiction rewires the brain's reward circuitry. Studies using brain imaging show that compulsive sexual behavior reduces activity in the prefrontal cortex, the region responsible for impulse control, decision-making, and long-term planning. This same pattern is seen in substance addiction. The brain begins chasing stimulation, not satisfaction. Testosterone rhythms become erratic. Dopamine crashes follow short-lived highs. Anxiety increases. Sleep quality collapses. What looks like pleasure becomes a physiological debt. Balance protects the brain. When sexual activity occurs at a natural, moderate rhythm, dopamine rises and falls as intended. Motivation increases without burnout. Oxytocin is released, stabilizing the nervous system and reducing stress. Serotonin supports emotional regulation. This chemical harmony is not accidental. It evolved to keep men functional, focused, and resilient. The endocrine system responds powerfully to balance. Testosterone production depends on clear communication between the brain and the testes. Excess stress from suppression or addiction disrupts this communication. Balanced sexual expression supports stable luteinizing hormone signaling, which tells the testes to produce testosterone consistently. This stability matters more than peaks. Men with stable hormonal rhythms age better, recover faster, and maintain strength longer. Sleep is one of the first systems to collapse when balance is lost. Men who suppress desire often experience restless nights and early waking, driven by unresolved nervous system tension. Men trapped in addiction often experience fragmented sleep due to dopamine crashes and overstimulation. Balanced sexual activity, however, promotes parasympathetic activation after release, lowering heart rate and blood pressure and allowing deep sleep cycles to occur. Deep sleep is when testosterone, growth hormone, and cellular repair peak. Without it, no supplement or medication can restore vitality. The immune system also reflects balance. Chronic stress weakens immune defenses by suppressing antibody production and increasing inflammation. Addiction does the same through sleep deprivation and hormonal chaos. Balanced intimacy has been associated with higher immunoglobulin A levels and reduced inflammatory markers. This means fewer infections, faster recovery, and lower long-term disease risk. Emotionally, balance is the difference between grounding and fragmentation. Suppression teaches men to disconnect from their bodies, leading to emotional numbness and difficulty bonding. Addiction fragments attention and erodes self-trust. Balanced sexual expression strengthens body awareness, emotional regulation, and connection. Oxytocin plays a central role here, reinforcing trust, calmness, and psychological safety. Men who experience this balance often report improved relationships, clearer communication, and reduced anxiety. One of the most dangerous myths is that discipline equals denial. In biology, discipline means regulation, not removal. The heart does not become stronger by never beating faster. Muscles do not grow by never being used. Hormones do not stay balanced by being ignored. They stay balanced through appropriate activation, followed by recovery. Sexual health follows the same rule. Aging magnifies the cost of imbalance. As men get older, their margin for hormonal error narrows. Excess stress or excess stimulation has a stronger impact. Balanced sexual activity helps maintain nitric oxide production, vascular flexibility, and nerve sensitivity. These protect against erectile dysfunction, hypertension, and metabolic disease. Suppression accelerates decline. Addiction accelerates burnout. Balance slows the clock. Medical literature consistently shows that men who maintain moderate sexual activity report higher life satisfaction, better mental health scores, and improved physical function compared to men at either extreme. This is not about morality or lifestyle branding. It is about physiology responding to rhythm. Balance also reshapes identity. Men who respect their biology stop fighting themselves. They stop swinging between guilt and excess. They develop confidence rooted in understanding, not impulse. This psychological stability feeds back into physical health, reducing stress hormones and supporting long-term resilience. Perhaps the most important truth is this: the body always seeks equilibrium. When healthy expression is blocked, pressure builds. When expression is uncontrolled, systems overload. Balanced sexual health allows energy to circulate instead of stagnating or exploding. It supports clarity instead of chaos. Men do not need to fear their desire. They need to understand it. Desire is not an enemy. It is information. When listened to and regulated, it becomes fuel for health, creativity, and connection. When ignored or abused, it becomes a source of disease. Balance is not perfection. It is consistency. It is responding to the body instead of punishing it. It is aligning behavior with biology. And men who find this balance do not just avoid damage. They unlock stability, strength, and longevity that extremes can never provide. In the end, health is not built by denial or indulgence. It is built by rhythm. And for men, sexual rhythm is one of the quiet foundations of a life that remains sharp, grounded, and fully alive.